Local health officials will hold another news conference today at noon to talk about the local impact from the COVID-19 outbreak.
Tulsa Mayor G.T. Bynum joins us live via Skype talking about how the pandemic is impacting our city. Mayor, good morning, and wanted to start off by just asking, how are we doing as far as the peak of the virus and the spread of the virus right now in our city?
Well, as you mentioned, we're in the peak right now based on all the modeling from the Tulsa Health Department. They believe that the contagion rate on a daily basis of the virus is right now in Tulsa. And so everything that we've done over the last month to prepare and to build in these social distancing practices, this is the real test this week where we are. And then the other peak that we can expect from this one is the daily hospitalization rate that will come from everyone that contracts the virus this week. And so, our main goal with social distancing is to keep that daily hospitalization peak low enough that our local hospital system can handle it. And we won't truly know how well we're doing until, about 3 weeks from now when we hit that. But all that being said, the data that the health department is receiving based on mobility and online information that tracks mobility around town shows that Tulsans are doing what we need to do from a social distancing standpoint, which is wonderful news because, 3 weeks ago versus the modeling that the health department had 3 weeks ago versus what they have right now shows that we're saving thousands of lives by having this social distancing regime in place right now in Tulsa. So I'm just incredibly thankful for Tulsans for taking this seriously and doing what we have to do to protect our neighbors.
We're in a really tough time, obviously, with unemployment, loss of jobs, but also loss of businesses and loss of sales tax for the city. Just your kind of all-encompassing thoughts about the economy for the city of Tulsa.
Well, you're exactly right. And that's something that we're dealing with now on a daily basis at the city, is not just, managing the day-to-day of this slow rolling disaster, which is what it is. But also, I'm presenting a budget to the city council next week for the coming fiscal year. And what we see, our fiscal year ends at the end of June. And we see that we started out the year, first 3 quarters were amazing. We were up millions of dollars ahead of where we thought we were going to be. And then this hit, and then the energy markets tanked. And so we're going to be down several million from where we expected to be over the course of the year. Fortunately, the city council and I have built up a rainy day fund over the last couple of years that'll help us ride that out this year. And then in the coming year, we're going to have to make some very hard choices at the city as we work to have a balanced budget. We're not like other levels of government that can borrow money and run a deficit. We have to have a balanced budget every year. And that's a real challenge when you have such a precipitous drop in sales tax revenue, which is what we're largely dependent on. But I'm confident that the council and I will put together a budget that protects public safety for the citizens of Tulsa and balances that budget. And we'll move forward into the year very cautiously and conservatively.
Mayor Bynum, the talk nationally has been, who's going to reopen the country? The president says he'll reopen it at his news conference. Some of the governors pushed back on that. Who's going to reopen Tulsa when it comes to that time?
Well, they can all argue over who's going to reopen the country. I don't think any of that really matters. The practical application locally is that just as we slowly phased in the restrictions that we have in place in Tulsa, we will slowly phase those back. That's what the public health professionals are telling us needs to be done to cautiously ramp things back up from an economic standpoint. But I think more importantly, we have to have public health practices in place as we do that give your average person confidence that they're safe to go about their life as they were in February. And more than anything the president does or any governor or any mayor, that I think is going to be crucial for public confidence for people to get back to their daily lives. But the threshold that the Tulsa Health Department has told me we need to focus on locally is once we feel that we have passed that moment where the expected contagion rate could overload our hospital system, then we can begin to lessen the restrictions in place and allow people to slowly get back to life as normal. And trust me, I cannot wait for us to get to that point. I'm very eager for our economy to get back to where it was.
As we all are. Mr. Mayor, just less than just a few seconds, your one thought, your one message to Tulsans who are watching right now.
This week is the test for us. Everything we've done to this point doesn't matter if we screw up this week and don't practice social distancing and we overload our healthcare system in 3 weeks. So please remain vigilant and patient and keep doing what we're doing.
Mayor Bynum, thank you so much for joining us this morning, and stay safe.
Thank you. You too.